How you doing? So I wanted to give you guys a quick synopsis, a breakdown of what sesamoiditis is. So the consideration for this is just to give something to the coaches and the parents and an understanding or interpretation of what sesamoiditis injuries are among endurance athletes, but it does have to do with football, basketball, and other sports. So take it as you need to for that sport and specifically towards that injured person. Full case study, we just had an athlete come in. The sesamoiditis issue was actually resolved after the first treatment. However, the second treatment assisted in the full resolution of that. So I'm going to give you an indication of what that is, and then the terms of the treatment, and then what we do at Dallas Sports Recovery. First, my name is Mel. If you consider sports recovery, sports therapists, and sports scientists personnel to look into injury prevention, injury epidemiology type issues, and then considering soft tissue modalities as well as physical therapy, strength and conditioning, and athletic training modalities, Dallas Sports Recovery is definitely your place to go. Um, so with that being said, sesamoiditis is a name that's given to this injury commonly. The hallux is a bone that it has a what's called a it's called a first metatarsal. So there's inflammation that occurs and the sesamoid bone is floating and suspended, just like the patella of the knee. So oftentimes when you look at the joint itself, the first met is a ball and socket joint. So what that means, as it being what's called a condyloid joint, it can hinge, right? So the bone underneath it that sits there will be compressed in that little hinge area. So to your right, you're going to see the collateral ligament, as well as you're going to see the sesamoid pharyngeal ligament, and then the metatarsal sesamoid suspensory ligament. Those are three key ligaments that we'll typically treat at Dallas Sports Recovery by using the technique active release techniques. There's about 500 protocols for that specific group of ART treatments. There's also dry needling, grass thin, laser, some other modalities too within the rehab scope, even using blood flow restriction rehab. However, this one can easily be resolved because when you think about itis at the back of that, that's an inflammation of the actual tendon in the bone, right? So inflammatory tissues have caused that tissue to shrink, compress the nerve, and not allow nerve conduction or blood flow to that site. So the cool thing about this biomechanical analysis that we're going to do in a second is to see what type of muscles are attached to that joint and then how that hinge joint is affected. So I'm going to take you a little bit into a deeper dive really quick and then take you out of that one to show you how easy that is to be resolved. So giving you a little synopsis of the breakdown of the injury. This disorder is composed of about 9% of foot and ankle injuries. So it's really smaller on the scale of large scale injuries. So it's really easily to be resolved among some of the treatment interventions that are used faster. So 1.2% of these injuries occur in runners though, but you can resolve this by intervening with these treatments. So to give you an idea of what that joint again looks like, first metatarsal means the big toe, the hallucis area. The joint itself has what's called interphalangeal joint, which is the furthest from your foot and closest to the ground. And then that second joint area is called your metatarsal phalangeal joint. Distal to that or behind it is going to be something called a sesamoid bone. Underneath there, you'll start to see the compression that occurs in certain type of shoes, whether it be a Nike, an Asics, or Hoka. That compressive factor causes that tissue to get inflamed and swollen. So let's appreciate the anatomy again by looking specifically at the tendons and ligaments that attach at that distal interphalangeal joint first. One that crosses two primary joints is going to be something called a flexor lucis longus. That flexor lucis longus tendon will cross two of those joints primarily. The long tendon going to the distal part of that big toe which has to be treated consistently because of the amount of ground reaction forces that occur through pushing off to that big toe and how many times we hit the ground and push off of it. So second to that, which the capsule itself is just below that. So the capsular joint needs to be released. That joint capsule has where inflammatory markers tend to sit, and these inflammatory markers tend to compress it and cause fibrotic changes. So those fibrotic changes don't allow optimal motion from that joint segment. Below that, we'll look at something called a flexor hallucis brevis. So those have two contact points on that interphalangeal joint, that MTP joint. So those two contact points are basically like a bicep muscle, right? So based on how the foot pronates, caves, and stuff like that, you'll get more tension on one side versus the other. And then one of the other ones that I really like to treat a lot on athletes is the adductor hallucis. The adductor hallucis has two heads, a transverse head and an oblique head. What that means is that toe is going to track if we're getting tension and pulling on the medial side. It's going to pull that way. Sometimes you'll see something called valgus instability where the toe curves. So if this is your big toe, you'll see the deviation. It'll curve. Adductor hallucis, that oblique head, is going to be a different angle down, an oblique angle. Transverse head is going to pull it straight across, where the oblique head is going to pull it in that 45-degree angle. Both of them need to be treated. However, one may experience more tightness than the other. That's where we use a lot of our manual palpation to identify where that's coming from. That's the other thing to note is a trained therapist, licensed therapist needs to be addressing these injuries to really identify where they're at because of the amount of repetitions that foot makes. The abductor hallucis is oftentimes weaker because it can't pull the adductor hallucis away. So it's on this side, so it has to pull it away. So that's something to do in terms of exercises for abduction, so pulling it away from that site versus adduction, pulling it towards. Okay. So next, I would like to show you the windlass mechanism because I know it's a common mechanism that's talked about, but get a sense of how that MTP joint, that big toe tends to have a ligament attached to it, right? So, in a sense of that muscle tendinous junction, right here, that is going to pull and get taut. Okay, the plantar fascia underneath it is just a transmitting of forces like the IT band. So that's not what you're actually seeing. You're seeing a muscle called a flexor hallucis longus. So that goes underneath and attaches, pull it to that distal interphalangeal location. It'll pull and cause that tautness once that toe goes up. And you're seeing the first met, but you're not seeing the sesamoid bone underneath it. So in the C picture, you're actually seeing the letter C. You're actually seeing the tension and the ground reaction forces going through the big toe, but the bone coming straight down. So in that sense, the muscles underneath the foot tend to compress and pull at that attachment. So what they do when they compress is they pull at this attachment, a little bit here, but once you compress, the distal portion, all of this becomes taut, and then the toe tends to go into this position and then adduct it like towards you. So down and here. Okay. So over time, it gets so bad, you'll hear more exacerbated issues like plantar fasciitis. Sometimes you'll get some of them with different deformity where it's more severe and fibrotic underneath there. It's calcified towards like 18 months with chronic plantar fasciitis issues, or it essentially goes up and it becomes Achilles tendinopathy, and then essentially that becomes a worst case Achilles syndrome. So those are cool ways to kind of prevent that stuff with the type of treatments. So I just want to give you a quick back brief on one, utilizing things like active release technique, giving you a sense of how some of these things can be intervened for your runner. The cool case report we just talked about with a runner coming in, having the treatment and having sesamoiditis from an MRI, firmed, right? and then to have the treatment resolved in less than 2 visits by releasing a tension underneath at those specific sites, specific muscles, and then being able to get the athlete back out there. So now they know what type of treatment interventions they need, where let's say 1 mile equals 1,000 foot contacts. So we're at the 10,000 foot contact time frame, then we would look at some other interventions if the pain still is exacerbated. All right, so to give you a indication of how to find us, we'd like to thank you for your time. You can utilize the website Dallas Sports Recovery, or you can call 214-242-0350, and we're more than happy to take care of your athlete, yourself as well, and get an indication of what that treatment feels like. All right, thank you so much, and we really appreciate it.